For us at the local level, especially to make policies that are for the overall good, we need extremely reliable information. One size fits all is no longer valid. It's a dynamic position that we're in. The state and the county is looking to open up and do various things, but we do those things safely with information.
For a new disease like COVID, we don't really have a good treatment. So in that sense, just testing sick individuals doesn't influence in a big way the clinical decisions you make. We now know that there is a lot of asymptomatic infection. Test a random sample of the population and then learn from that random sample how deadly this disease is and how contagious this disease is. In Santa Clara County, we tested a large community sample of 3,000 individuals. We've tested more than 5,000 Major League Baseball employees. So what we found out in LA was that the true extent of the infection was about 50 times higher than the number of confirmed cases. The majority of individuals who are infected do not seem to have symptoms that are consistent with COVID-19. The best predictor of having a COVID infection seems to be the loss of sense of smell or taste. Infection rates vary by geography, income, race, ethnicity, the neighborhoods you live in. You need to do this study in your community. The true number of cases of COVID is much higher. Therefore, the true mortality is going to be much lower. The chance of the virus overwhelming the healthcare system is still there, but it's going to be lower than what we initially assumed or forecasted. A lot of scientists believe that we will hit herd immunity when either 60% of the population has been vaccinated, or if 60% of the population has been infected and has some immunity from the disease. We are very far away from reaching that level. We need to have a long-term plan. What you're doing with social distancing is you're changing the peak of the infection, but you're not changing the area under the curve or the total number of infections. But it's making sure that everyone doesn't get infected over the next month and overwhelm the healthcare system. But that has to be evaluated against the cost of social distancing. It might increase the second peak or second wave of the infection. Being stuck at home, not being able to meet people, creates a lot of stress and anxiety. Economic implications, not only for citizens, but for businesses, nonprofits. Now there are a lot of people who have chronic diseases, but they don't want to go see their doctor. We're not allowing elective surgeries and people are scared. With stringent social distancing, we have a lot of children who are out of school. You'll need to look at all the benefits and costs beyond COVID-related outcomes. So you should not just think about social distancing. The flip side is you can increase the supply. So you can have many more hospital beds or many more doctors so that the system doesn't get overwhelmed. It has higher capacity. Similarly, instead of saying everyone stay at home, you might want to do risk segmentation, not think about a one-size-fits-all policy, but think about different risks for different populations. Think about a variety of policy options. Think about all the benefits and costs. Don't just focus on COVID-related mortality, and think about a longer time horizon.